I just wanted to give a little background about who I am. I am a veterinarian. I graduated from the University of Illinois in 1995. I was in general practice, solely small animal for the first 17 years of my career, and then I slowly started becoming more interested in looking at alternate ways that I could improve quality of life for my patients, both with behavior and mobility, because these were the two areas I felt I was lacking in ability to help them. If they were having lameness or trouble getting up, that would often be the end point for my patients. So I started looking into the physical modalities and studied veterinary spinal manipulation therapy through the Healing Oasis chiropractic. And then I got certified in acupressure through Tallgrass Animal Acupressure Institute. And with that, I became really focused on, I've got the manual therapies, but I want to learn how to improve mobility and function now that I've done some of the manual work. So I wanted to study rehab, and I went to the Canine Rehab Institute and got my CCRT, and has led me down this path of migrating from being a general practitioner, applying rehab and chiropractic, to full-time standalone rehab practice here in Pacifica. And I love it. I have a number of wonderful clients that come for their older pets for pain management. I have a number of clients being referred by surgeons and neurologists for post-op rehab, or when they can no longer help them surgically, neuro rehab, or for degenerative conditions that are progressive. And so when I started my practice, I started off with a laser and an underwater treadmill, some of the big, commonly used modalities, in addition to my hands and in addition to therapeutic exercise techniques that I've learned. But what I soon started to realize was that laser and my hands could only do so much for some of the more fibrotic tissue. And I had my first case of a German Shepherd with fibrotic myopathy. And he had seen the surgeon, and the surgeon didn't find anything with his stifle joint or his hips or his spine. He saw the neurologist. They all cleared him of any underlying pathology, but he had an abnormal gait. And when he came to see me, it was very clearly the beginning of German Shepherd fibrotic myopathy. His gracilis was tight, much tighter on the right leg than the left, but both were tight, and his semitendinosus muscles. So quickly, I recognized the pattern, and I contacted one of my colleagues in the East Bay in Oakland, who had worked at the Animal Medical Center for quite some time, Dr. Jennifer Damasio. And I asked her, what did you do at the AMC for these fibrotic myopathy cases? And she said, hands down, the most helpful treatment was shockwave. So I said, okay, do you have it in Oakland? And she said, oh, no, we don't have it. And I started to check around, and it turned out that nobody had it in this area. A handful of people did. And then I started to research more about shockwave, the difference between focused shockwave and radial shockwave, high intensity, low intensity. It was all new to me because we had heard about it at Canine Rehab Institute in our training. But I had kind of dismissed it as a modality that I probably wouldn't get, that I would probably get ultrasound, but not shockwave, because I had kind of been told that it was, A, it was very painful for the patient, B, that it was very loud, and those two factors meant that you had to sedate the patient in order to do the treatment. And those were the two main drawbacks for me, really. And C, I thought, well, I can't afford to pay so much for a piece of equipment that I might use a handful of times. What I've learned since then is that it doesn't have to be that kind of session. It can be low intensity, it's not loud, it's not painful, it can be an outpatient procedure, and it is with my patients, and I get tremendous results. It would be easier to tell you which cases I don't use it in when it's contraindicated, as opposed to how to use it, because I use it in almost all of my patients. Primarily treating myofascial pain and osteoarthritis pain. So I had the PiezoWave2 demonstration. I lined up, they said bring in a couple of patients so we could show you, and I lined up patients back to back every half hour for like probably 11 or 12 patients. And every single one of them at the end, the next day reported to me that their dog or their cat, we treated one cat, felt so much better. They wanted to know, when was I getting my machine and when could they sign up for more therapy? I also had a demonstration on myself, on my own myofascial pain, by Joe Lemon, a human rep. We had both Joes here, and it was incredible. The immediate relief of pain and tension in my neck. I like a lot of overusers of the computer and doing the work we do, looking down a lot. I created a lot of overuse strain of my upper trapezius, my deltoids, and I had some pretty nasty trigger points in my neck and loss of range of motion. And Joe just did one treatment to demonstrate what it would feel like, which was really important to me so that I would know how it felt in my patient. But also the relief afterwards was so profound and so immediate. I thought, oh my God, even if I get this machine just to use on myself, I'm getting it. So that's how I progressed. I also did a little more due diligence. I looked into getting the an electrohydraulic model in for a test trial. But when I talked to folks who had the I call it the PiezoWave, I'm a PiezoWave vet, too, they also told me, and I learned that you don't have to replace the parts as often. And I had no idea that with the electrohydraulic, I would have to replace the trodes every like 15,000 pulses practically. And my average patient, just to give you an idea, my average patient I might treat for 10 to 15,000 pulses per patient. A half hour barely covers the amount of time if I'm covering the whole dog. Sometimes my patients have so much myofascial pain from compensation. Sometimes they can be so chronic, the cases, that we need multiple treatments, but I can always see the immediate benefit and effect. So these are the three big things that I think this machine gives me that my laser really doesn't, and that electrical stim, e-stim doesn't, and e-stim acupuncture doesn't. And I've had all these modalities on myself, and I can say that this also provides me with the most instant pain relief. So it's acute pain relief, and there's a number of studies out there looking at the reasons why, whether it's due to competition at the dorsal root ganglion and inhibiting the descending pain pathways, or stimulation of the A delta and blocking the C fiber transmission, affecting substance P and other chemicals in the inflammatory process to relieve inflammation, and even mechanical compression. This is what I found most interesting, the mechanical tapping of the sound wave itself, tapping on the very small nociceptive fibers, the very unmyelinated superficial fibers, could actually be kind of basically depolarized and not able to regroup themselves, not able to start firing again. And so it was an immediate relief of myofascial pain and tension. And I wanted that for my patients, and I see that in a number of my patients. So pain relief is the number one thing I'm using this for. It also softens tissue immediately. If the muscles are tense, they're no longer tense when you relieve the pain, and I can stretch them better. I can do my manual therapy better. The patient relaxes better, right, Donna? The patient relaxes, and literally I'll go from having a shaking, quaking dachshund with the eyes bulging, muscle fasciculation as I palpate up the spine, and dropping in the center when I get the T10, and then halfway through the treatment, they give an exhale, they sigh, they put their head down, and then they stretch out like a rubber band, and no more muscle fasciculation by the end of my treatment. The clients and I can both see it, the dog feels it, and it's a great thing. The second reason that one might want to use this machine would be, a big reason would be to break up tissue, that's scar tissue, calcified tendons, ligaments, myofascial trigger points or knots within the muscle. It's a really great tool. I know acupuncture needles are great for myofascial trigger points as well, but I find that treating with shockwave, I'm not just treating locally in the trigger point, but I'm fanning through the whole muscle belly, and I'm getting the fibers and the whole fiber, where the trigger point is maybe just a bunched up collection of fibers at a motor segment of the muscle. I'm treating the whole tissue, I'm treating all the fascia, all the superficial nerves that are in that area, the layers of muscle, depending on how deep I go with my gel pad. So breaking up tissue, blocking pain, and then lastly, another big biological effect, when you look at the literature, is stimulating regeneration of tissue. It jumpstarts the growth factors coming in to build more fibroblasts, collagen stimulation, chondrocyte and osteogenesis, so bone remodeling, cartilage repair, fibroblast production. So it's great for those non-union fractures. It's great for comminuted fractures. If you're a surgeon and you're treating a patient and you're putting the Humpty Dumpty back together again, and there's a lot of soft tissue trauma and fragments, you know, I liken it to, I think of it as debriding the bone without getting the scalpel blade into the tissue. The little pulses, the shock waves themselves mechanically are tapping the tissue and causing that little microvascular trauma and encouraging remodeling. So just to get started on the actual demonstration, so just to say, the sound wave is created here in the transducer head, and it travels using gel in the inside. I'll put it in a minute. It travels up through the pad, and its peak absorption, and this one would be on the surface. So this is going to travel 3 centimeters through the pad, and I'm going to have my maximum treatment if I wanted to do really superficial tendon ligament work. But you can see from this nice clear pad, I don't use it very often. The 2 pads that I tend to use the most happen to be the 15 millimeters and the 20. So I'm going to choose for treating Donna. I want to treat Donna, her back. She's an IVDD case. She has chronic disc disease. She's never had surgery, but she has flare-ups from time to time of back pain, where she'll come in very kyphotic, arching her spine, moving slowly, not wanting to lift her head, not wanting to go upstairs, and sometimes also a little ataxic in the hind end. I'm going to put for her, I'm going to go 1.5 centimeters on her tissue. So take my gel, and you go through a lot of gel in this field, and you want to put your gel in the transducer and put your gel pad in with no air bubbles. So get this all set for her. And she's had this treatment before, but usually if it's the first time I'm treating a patient, I'll let them sniff it, check it out. Set it for 6 as the pulse, as the hertz, the frequency. This goes up to 8. And I started out treating, here we go, Donna, treating patients using the low to moderate energy density. And there's a little chart I've created for my patients to track their appointments. And I have in there the area of treatment, which standoff pad I've used, so how deep I'm going, the intensity or the energy level that I'm using, the number of pulses per region, and then the total energy flux density dosed to that patient per region. And this probe that I have, the F7G3, can go up as high as 0.4 millijoules per millimeter square, which falls about halfway in the moderate energy range. And believe me, that's plenty of energy, because when I've treated myself at 20, it's very powerful. And I've only used that a handful of times in dogs, specifically with fibrotic myopathy, and that shepherd that had chronic disease. And so I've learned over time to dial it down, and now I start somewhere between 0.5 and 0.8. And even sometimes have to go down to 0.1 or 0.3 when I'm treating a patient. And I'll start her at 0.5 because I've treated her there before. So I'm just going to go ahead and hold her on my lap, and I'll just show you a little bit of what the treatment would look like. Okay, you're okay, Donna. So I'm at 8. So I'm down at 6 is my pulse frequency, and I'm at 0.5, and I'm treating the area that primarily she has had myofascial pain in the past. Today, normally I checked her before the start of this webinar. I would palpate for muscle fasciculation, and I look for that fasciculation, and I start treating in that region. I'm aiming my probe slightly at a 45-degree angle towards the multifidus muscle. At 1.5 centimeters, I should be on multifidus, and I'm at the transverse processes where the spinal nerves are coming out. I know that those spinal nerves are heavily myelinated, and there's no way that this intensity of energy is going to hyperpolarize those nerves, but it is going to affect the nociceptors in the tissue around those nerves, relaxing them, and so it's a good way to block pain distal to the limb based on the spinal segment that I'm treating. But in her case, I'm also treating based on her pathology, where she has evidence of myofascial pain. And basically, every patient that I see has myofascial problems, whether it's from a post-TPLO, whether it's from patella luxation or post-patella surgery, whether it's cranial cruciate ligament, chronic disease, hip dysplasia, elbow dysplasia, and of course, you get the muscles surrounding those joints are trying their best, are compensating for the unstable hip or the painful elbow or the painful shoulder by overuse strain, muscle strain. And so with the overuse strain going on, you end up with myofascial strain patterns that are pretty common, and the more you palpate patients, the more you'll find them. And that's what I've used my 5.5 million pulses on primarily, is the myofascial strain patterns and the pain that comes from having a bulging disc, and all the muscles around it are overstimulated and trying to guard that painful area, or from the hip, or from the knee. And so I see a lot of trigger points in the proximal sartorius, proximal quads. I see a lot in the equivalent of the dog's iliotibial band. You know, if you're an acupuncturist, you know, stomach 34, that region, the lateral aspect of the insertion onto the tibia of your vastus lateralis, and you're also going to have your tensor fasciolata coming in there, biceps femoris, and so those muscles are all going to relax when you treat that area, when you treat the Golgi tendon bodies for the muscle tendon junction in that region of the knee. I also use it a lot for swelling and edema, joint effusion. So for osteoarthritis, if you have a hot, swollen joint, I turn it down pretty low. Good girl, Jonah. I turn it down pretty low for that region, but I treat around it. I treat the trigger points, and when they're less painful, then I can go ahead and treat a little bit more over the swollen joint. So in a post-cruciate injury, if they come in with a lot of joint inflammation, peripatellar effusion, it can really reduce the effusion. I also am using it for patella tendonitis cases. Patella tendonitis, there's actually some recent research showing that it moves fluid out of the patella tendon, and you can have a measurable decrease in the thickness of the tendon over time. Plus, it's helping to increase vascularity in the tendon at the junction with the bone, the insertion. So you have healing for your Achilles strains, your patellar tendon desmitis, and a number of things. I use it a lot for neck cervical pain, for atlas subluxation, where I have really tight muscles, omotransversalis or brachiocephalicus up in the cervical region, pulling on the atlas, really relaxes it. And then for my manipulation, chiropractic adjustment, I can do a much better manipulation after I've relaxed the tissue. All right, so Donna has been a great demo dog. She had 1,500 pulses just fanning through the tissue here. Normally, she has a little bit of fasciculation. I treated her last week on Tuesday, I believe it was, Tuesday or Wednesday, and that's the most frequently that I would treat. And sometimes it's just 1 or 2 treatments. If the problem is not real chronic, you can resolve it. But if you have chronic osteoarthritis pain, then you're going to continue to fall back into those strain patterns, and your trigger points that are latent, are going to flare back up again on you. So what happens after I treat the spine then, and I've got a dog who's relaxed, not trying to walk away, not sore, I'll combine my treatment with manual therapy. I'll do my DV joint glides, I'll do my stretching, passive range of motion, soft tissue mobilization, and ischemic compression to try to work out any trigger points that I have, that I've found. I've identified it with the probe or with my hands. And then I'll do therapeutic exercise and or hydrotherapy to strengthen the muscle. And the way I see it is, it's very hard for a patient walking in the door, hiking up their leg with the trigger point in their proximal quad, to then do exercise to strengthen a quadriceps muscle post-TPLO surgery. So first you have to do your manual therapy, and I would do a lot of that. I would use the laser, but I was not getting the immediate relief and relaxation of the muscle that I get when I use shockwave on those trigger points. So we'll bring Rambo in. He has bilateral patella disease. He had surgery on both knees, and he came to me about a year ago with corrected tracking patellas. They're tracking nicely in their grooves, but very tight and contracted hamstrings, very tight and contracted iliopsoas, and the hip flexors, sartorius, quads, trigger points all over the place. And he was walking still in a very crouched position, could barely climb upstairs, could not jump up into the car, onto the couch, couldn't extend his legs and bear weight properly. So we started working on his soft tissue, his gracilis and his hamstrings, his stifles, with the shockwave and with manual therapy. He is a special guy. He also has caudal occipital malformation syndrome, or COMS, with syringomyelia. So when he gets tight or has fascial pulling in his hip, sometimes it affects the rest of the fascia along his spine, and he gets tight where you might start to see him having the reflex kicking or the pain response that can happen sometimes. When I hit a trigger point lower down, you can see the effect of the fascia. And I felt that myself, treating a trigger point in my neck. I can feel the fascial plane and the muscle tightening all the way down the center of my spine. I always start palpating first, palpate his trigger points, and I'm looking to see how tight he is, if I can get hip extension, and he's feeling pretty good today. We treated him as well last week. If he misses more than 2.5 to 3 weeks of treatment, his mom and I have discovered that he gets very tight again, and we can't extend the hips, we can't extend the stifles. He starts not wanting to walk as much if he's not stretched. Just doing regular exercises and massage at home is not enough. So what I usually do for Rambo, again, I set it at 6 pulse frequency. Rambo doesn't need more than 0.5 on the machine intensity, so it's pretty low intensity. I tend to treat Rambo his psoas, his lumbar spine. He's often very kyphotic, and he does have more stresses on his left stifle because he has some more patella laxity again over time. He's been wearing down the groove that was made during his surgery. His patella is still tracking, but loosening up the sartorius, the biceps femoris muscles that also insert on the patella are going to help keep it tracking, rather than if the sartorius and quads are tight and the leg is flexed all the time and they get shortened, that's going to cause it to luxate even more. And I've actually seen a few patients resolve acute traumatic patella luxation with just treating the myofascial trigger point with shockwave. The patella stopped luxating completely, and then we were able to start strengthening to help keep it tracking properly with stretching and your regular rehab protocol. So you can see I use it for acute problems. I'm using it in him for chronic problems. Let's see if he'll sit tight for a little bit of treatment demonstration. Very gel intensive treatment to get through the fur. I prefer to use a lot of gel than to not have the treatment reach the tissue. I can even feel it on myself when I treat myself and there's not a lot of gel versus when I have to treat a point and I add more gel. I can feel the change, the increase in intensity of the pulse delivered. So I know that the gel makes a big difference. And usually we'll do the treatments prior to water therapy, whether it's swimming and stretching or underwater treadmill and stretching, or whether we're going to be doing therapeutic exercise and stretching for that day. But usually if they're gooped up in gel, we rinse them off and get the water off, get the gel off in the treadmill. Rambo has been coming for treatment. We try to treat to effect. I have a couple of cat patients 3 cat patients, all 3 with stifle problems. And the stifle disease, both patellas on one cat and another cat was traumatic, patella luxation as well as cruciate rupture and instability. And the cat had surgery. Both cats had had multiple surgeries to try to correct that. And it was, unfortunately, one of the cats had a grade 4 luxation at the end. The patella just wouldn't stay in the groove. And we started to work with that cat with shockwave, and within one treatment, she went from completely being flexed at all times to toe-touch weight bearing. After 4 days, she started hiking it up again. We treated a week later, and she was doing more toe-touch weight bearing to the point where they could start doing therapeutic exercise and encourage the cat to use the leg. By the 3rd treatment, she was completely toe-touch weight bearing the whole time and starting to bear more weight and no longer returned to holding the leg. So it took a couple of treatments and then the effect was cumulative. Again, my philosophy has been no pain. I don't want my patients to be in pain when I'm treating them. I treat with more pulses at lower intensity. And you can deliver the same total EFD, energy flux density, if you do 100 pulses at a high intensity or 1,000 pulses at a low intensity. You can deliver the same amount of total energy without the traumatic biological effect of creating tons of inflammation. Creating just enough inflammation, you're doing enough to relieve the pain. Biological effects are really good, and I'm able then afterwards to do a lot of manual therapy and stretching after the treatment without causing pain. A lot of times I can't stretch these cats or these dogs at all until after shockwave, and then by the time I'm done, I can fully extend. Sometimes during treatment, when I'm on the right point and relax the muscle, the cat will just stretch the leg right out all by himself. And so I've had a couple of these cases now where shockwave, after everything that could have been done, rehab, laser, surgery, and still not using the leg, and in 2 of those cases, we got them using the leg based on adding shockwave combined with manual therapy. They wouldn't let me touch the leg before shockwave, too painful. After shockwave, relaxed, more comfortable, and allowed a lot more manual therapy, allowed scar tissue breakdown, and then allowed muscles to be rebuilt. I guess I'll just talk about a few other common things that I've treated that you might find in your practice, walking in the door if you're a rehab practitioner or if you're a surgeon. Shoulder, so supraspinatus, tendinopathies, biceps tendinopathies, medial shoulder instabilities, trigger points set up all around those injuries, so you then have weakening of your muscles. That doesn't help the situation any. So treating the trigger points, treating for inflammation within the tendon at low intensity to help facilitate remodeling at the tendon-bone junction, getting fluid out of the bursa, relieving pain, and then you can work with building strength and re-strengthen those muscles, recruiting more fibers, and hopefully stabilize that shoulder with rehab. Really friable, fragile tissues, I would be very careful and not hold it in one place for too long. So if you have an elderly patient with a lot of muscle strain, I like to fan through the tissue and then come back over it, especially if I hit a painful spot or I see fasciculating. I'll go there and I'll hover there for a couple of, maybe 100, 200 pulses, and then I'll move through and I'll come back to it. And I treat to effect, right? So I treat till I test them again and say, is it resolved, or do we need to treat another couple spots? I use it for chronic elbow arthritis, like I said, tarsal, anywhere there's arthritis. I do use it a lot on the upper cervical. I'm getting a lot of relaxation. Those of you who have studied medical acupuncture, you know how many tissues you affect when you have a mechanical force applied to, areas around the spine. You have all of the spinal nerves, you have the superficial, the nociceptors, the fascia, the muscles, the skin. You're affecting blood vessels when you're using the shockwave pulsing on the blood vessels, and the blood vessels are loaded with autonomic sympathetics, because when you're especially in your extremities, when you have heat, you have to thermoregulate, so sympathetics are helping there, so you're affecting your sympathetics. So I just have patients, feeling really good after their treatment, and then we get them in the gym and do the work that we need to do. I've used it for non-union bone fractures, and primarily to get range of motion back in the joint for all the scar tissue and connective tissue that has contracted and shortened from disuse and from disuse atrophy. I do use my laser in conjunction with shockwave. So how I integrate it is on our first visit, we treat with all the modalities that we feel are appropriate for that patient. So if the patient has tremendous myofascial problems, we'll treat with that. If they have an extremely painful joint, I may not use shockwave on it right away because I know how that feels. Even on my ankles, I set it at 0.1. That's the absolute lowest intensity setting that this can go. And I still had tremendous pain. So I knew I had a lot of scar tissue there. So I'm not going to do a painful treatment right over the elbow, so I'll use laser over really arthritic joints initially, and then I'll start using shockwave around it to loosen up the fascia and get better range of motion. If you treat the muscles, then you can do a little more mobilizing of your joint. You do your glides, your joint distractions. I don't shave any of the dogs. I go through a whole lot of gel. It's a very gel-intensive practice. With the very thick-coated dogs, you have to know your anatomy. It's not like laser, you just point and shoot and you're covering a region and you know you've got it within your field. It is an anatomy dependent. You have to know your anatomy. You have to know your anatomy to know how deep you want to go with your gel pads. You know, you want to know, I'll switch pads in the middle to treat a patella tendon. I might go to the 5 millimeters, and then I'll switch to a 20 millimeter, 2 centimeter depth to treat the quadriceps muscles. You know, with little Ladybird here, she's got trigger points in her shoulders and her elbows. She's got a lot of arthritis. So, you know, I would be using different pads. So I guess what I would say is, you know, I start off with a lot of gel and don't shave, and I have to just add more to get through their coat. My frequency of treatment is, my guideline is no more frequent than every 5 days. So typically we'll do a once a week treatment. And most of my clients, after 1 or 2 treatments, they see how much improvement their animal has. They feel so good that they really want to do more. And so we offer it as a treatment package of 5, because I find on average 5 treatments is what it would take to really resolve some of the chronic issues. And sometimes I'll layer the treatment. I'll use different depths of the probe to have my maximum energy delivered at superficial and going more deep, because you've got muscles on top of muscles with fascial planes in between, with nerves in between. And so, you know, if I'm just treating the same depth every single time, I might be missing a lot of what I'm looking for treatment. And then basically it's a maintenance treatment for a lot of these arthritis patients, chronic hips, chronic elbows, chronic stifle DJD. Well, maybe every 2 weeks. When we try to go to once a month, a lot of these patients start slipping back into old patterns of muscle contracture and pain. And so I let my clients dictate, you know, if they want to come weekly, if they feel like they need it, or if they want to try to spread it out every 2 to 4 weeks. So my fee basis is basically I charge for my time. So that's the beauty of this machine. I'm not charging per pulse, because I don't have to replace my electrode pads every 15,000 pulses, thank God, because I'd be replacing it every other patient. I don't even know how I would practice that way. And I also feel like I'm not limited then by how many pulses I can deliver. If I'm treating a patient and I have to stop at 800 pulses because that's all they can afford to pay for, I'm not doing any treatment service to the patient. I'm not really treating the whole body. I'm treating one small area, and it feels like allopathic medicine, where you're just focusing on the knee and you're ignoring the shoulders and all the compensatory changes from shifting weight forward when you have chronic hip pain. I treat the neck and the shoulders and the carpal joints a ton on these older dogs that come in with chronic hip dysplasia. So we'll treat the hips, but we're also treating most of the body a lot of the time. And so, you know, half-hour treatment is about $100. And I think about it, likening it to the Bay Area, half-hour treatment recheck acupuncture runs between $100 and $150 per session. So they're getting the manual therapy at the same time as the shockwave, and a much better manual therapy session when I do it with the shockwave.